Welcome to Focus on Health, our next edition. We have a great show today. With us today is Albert Wall. He works for New Horizons. He's the developmental director there, and we're going to learn all about that. He's a very interesting character, and it was very nice to meet Albert, and look forward to the show today, and welcome to the show.
Well, thank you very much. I'm glad to be here. Thank you for inviting me.
Well, good. I'm glad to have you here, and before we kind of get into New Horizons and where you work and a little bit about that, tell me a little bit about your professional and educational career, because that's quite interesting in of itself.
Well, I'm originally from Alaska, and I've been a minister for about 20 years now, an ordained minister, Baptist. And so my professional experience has crossed both the ministry and the nonprofit world. I've worked with a lot of nonprofits and mission organizations and things of that nature. But at the same time, I have a professional background in counseling. So I've been a licensed marriage and family therapist and have about 15 years in that field. And so I kind of have an understanding of both, or I'd like to think I have an understanding of both the ministry and the needs of people in counseling.
Wow, that's interesting. And so New Horizons was very fortunate to get you. I think that's awesome because you've been with them for about 6 months now.
Just 6 months, yeah. And I like to think that I've been fortunate to be at New Horizons. I very much enjoy the organization. And I've been a U.S. military chaplain for many years. Still am in the National Guard as a chaplain. But I just came off active duty, and we were here in Columbus, and my wife and I love the area, love the people, so we decided we would stay here. So it's been a really good fit.
That's great. And New Horizons is based out of the Health and Human Service building, which is on the corner of Taubleton Road and Comer Avenue, which is also where you find Public Health and the Department of Family and Children's Services. And there are so many agencies in that building that they are indeed separate agencies, and oftentimes people get them confused and think it's just one big pot, but there are a lot of resources in that building, and New Horizons offers a tremendous amount of resources to the public. So we're going to talk a little bit about that today.
Yeah, there really are a lot in that building, a lot of people in that building, a lot of services in that building. So
I think it's a wonderful service for the community to have all of that in one shop. But I think sometimes people get a little bit confused about where do I go for a certain service, or what services are even in that building.
Yeah.
So let's get right to it. You work for New Horizons, so tell me a little bit about New Horizons. What is New Horizons?
Well, the full name of New Horizons is New Horizons Community Service Board, and it's actually a safety net provider for mental health, developmental disabilities, and addictive diseases in most of western Georgia. We have a very large catchment basin of 8 different counties, in offices in all of those counties. But we serve a population that has a great deal of need, and there's not a whole lot of services in their area. We do have a couple of central locations like 2100 Comer Avenue, which is pretty much on the campus of Columbus Regional and the Department of Health. But we also have buildings, the Developmental Service Center, which is here in town. Cornerstone is here in town, Reach on 2nd Avenue. There's a lot of different services that are provided in the area. So the best thing to do if you have a question about where a service is or what kind of services we have is just go ahead and give us a call. We're at 1-800-241-3659, and it's very easy to talk to the people at the front desk, and they'll tell you who you need to call or even just transfer you.
So now you mentioned that you cover 8 counties. That would be Muskogee and then the counties out around Muskogee. Do you have facilities in those counties, or pretty much it's based out of Muskogee? No,
there's services in the counties, and I'll tell you the ones we cover are Muskogee, Harris, Talbot, Randolph, Clay, Stewart, Quitman, and Chattahoochee. And so it's a large area. There's over 350,000 people in that area, and we certainly serve people that are outside of that area as well that come in, but those are our primary area of jurisdiction. It might surprise people to know that New Horizons is actually a nonprofit. There has been, like I said, I've been here 6 months, and when you talk to people in the town about what New Horizons is and what we do, there's some confusion about whether or not we're a government agency or we're a healthcare provider that's private or who we are. So it might surprise people to know that we're actually a nonprofit. That's just a very large nonprofit.
That's very surprising because you think about all the government agencies that are in that building, And so you just
Yeah.
would naturally think that you were just strictly a government agency. So the fact that you're a nonprofit is quite interesting. How does that how does that affect the services that you offer being a nonprofit?
Well, what it does, there's both challenges and benefits to that.
Right.
For the people that we work with, for our clients, there's the benefits of we serve everybody.
Right.
It doesn't matter if you have insurance, if you don't have insurance, if you have a job, if you don't have a job. It doesn't matter if you're military or a veteran. We serve everybody. So regardless of even your ability to pay sometimes, we serve everybody because as a nonprofit, we're in a position where we can do that. The challenges for our organization then become how do we get the financing, of course, to provide those services to people that are in need. So we rely a little bit on community involvement and sponsorship, and we also accept fee-for-service and insurance payments and things of that nature. So.
I know I'm very familiar with nonprofits through the health department. We also are the lead agency for our local Safe Kids Coalition, and it's the same way. You serve everybody, but then it becomes a challenge as to how you actually get your funding and be able to obtain and keep funding and still push out the services that the public so desperately needs. So, all right, so now let's talk a little bit about services. What types of services can one find at New Horizons?
Well, we pretty much break it down in 3 different areas. We serve individuals and families with a member that have developmental disabilities, severe developmental disabilities to not so severe. Mm-hmm. And they can go to residential services, they could go to daycare services, they could go down to sheltered employment. We have a lot of life coaching and counseling and intervention and even in many cases in-home services that personal care providers will go for. So there's just a very wide variety of services that are provided for the developmentally disabled.
And so you said that you're based mainly out of the Health and Human Service building. What are your hours of operation there for New Horizons?
Well, they're what you would typically consider. It's 8:30 to 5 or so. Our intake office up there is where pretty much everybody is funneled into to begin with until we know what your needs are. So you can go up there on a walk-in basis, or you can call the 800 number and get an appointment in advance. But then we will send you to the service that you need to go to. So, for instance, if you have an older child, 18 and above, 21 and above, that has autism or some developmental disability, they can go to our service center during the day, and there's care provided for them there, and training and activities and interaction and all that type of thing. Even community outreach, where we'll take them by transportation to the mall or shopping or something of that nature. And it's a good program. They're tremendous people up there. So.
When you think about your services, I guess the question that comes to mind, Al, is do you have physicians there at New Horizons that can actually treat and prescribe medication, that sort of thing?
Yeah, absolutely. And what surprises me about New Horizons is what I learn about it every day. It's just a very large service-oriented organization. So we have medical doctors, we have psychiatrists, we have psychologists, social workers, counselors, nurses, physician's assistants, and I'm sure I'm missing one, and I'll hear from somebody, but we have just a wide variety of professional, licensed, very quality care providers. And if I could just add, one of the reasons why I'm so glad to be at New Horizons is because of the employees. I've been in service to people my whole life, and I very, very rarely ran into a large group of employees that all care as much as the New Horizons people do about their clients and about their work. Taking care of people is what we do. The motto of the organization is building better lives, and I really think that's sunk into the employees. They really do care. They go outside. They go outside above and beyond what is necessary to make sure that the quality of care and the impact that they have on people's lives is the best that they can.
Well, we've laid out a huge array of services that are available to the public. So now tell me, who can actually obtain these services? Is there a certain criteria, or do you have to pass some sort of income test, or who can access the services?
Well, I'll tell you, that's That's a good question. Some of the programs do have particular criteria, and some do not.
Right.
So what I would suggest is that if you have a question, you can call the 800 number. Again, that's 800-241-3659, and ask the question. You can go on our website, which is newhorizonscsb.org, and look at the services there. Some of them do have eligibility requirements. For instance, the developmentally disabled that we work with are typically adults.
Right.
And so there is an eligibility requirement there. But other ones do not. We have the counseling center with mental health. Certainly there's not a requirement there for an age limit of any type.
So you see children through the elderly, all the way through?
Yes, ma'am. For certain services,
Right,
again.
right.
You know, we've touched on developmentally disabled, but we also have the mental health counseling and psychiatry. And so there's ongoing groups, and there's ongoing counseling, one-on-one, family interventions, all types of things that we do in the area of mental health, medication maintenance and things of that nature. But then there's also the addictive diseases part, substance abuse and recovery. And so those services are also open to a wide variety of people. We have recovery places and recovery centers and programs that people can go to.
So tell me a little bit about how one would contact New Horizons. If they either can walk in or they can call. And that's basically it. You have a website?
We have the website, www.newhorizonscsb.org. And on that is a number of email contacts that you can contact. You can call the 1-800 number, 241-3659. You can certainly walk in to the main office there on 2100 Comer Avenue.
Okay. All right. Well, I appreciate you being here with us, and we're going to take a break, and we'll be right back. Welcome back to Focus on Health, and with us today is Albert Wall from New Horizons, and we're going to continue our conversation about all the great services and programs that New Horizons offers the community. And we were talking during the break, and you guys have got a lot of great programs coming up. And so I want to talk about 3 of those so we can make sure the community knows about. The first one is New Horizons participates in a drug-free coalition. So tell me about that.
Yeah, the Drug-Free Coalition is, it's called the Drug-Free Community Coalition of Columbus. And it's a large umbrella organization that anybody can be a part of that's concerned about the issues. And our particular goal is to reduce substance abuse and use in the youth. And so we want to raise the level of awareness and address some cultural issues that are there regarding substance abuse, use, and abuse. Tobacco products, drugs, alcohol, the whole 9 yards. And so we are partnering with a number of organizations, the Muskogee School District, the City of Columbus, the Police Department, Family Connections, all of these groups, you know, the YMCA, and now I'm going to get in trouble because I don't mention everybody, but you can go on the website and see that. There's a large coalition of people in organizations that are concerned about this. Now, within that umbrella, there's a couple of other organizations that we partner with, like the Drugs Don't Work program for the workplace.
Right.
And they're focused specifically on the workplace and intervening with employees and, you know, the effects of drugs on the workplace, where we're focused on the youth and the children. And so they kind of go hand in hand. But we hope to, over the next year, really start making an impact on a broader basis.
How many members would you say the Drug-Free Coalition has now?
Last count, I think, and we had a meeting yesterday, there were 22 organizations represented. Wow. We have a student representative, we have just a concerned parent representative, businesses, healthcare providers, government certainly, and all kinds of people are there.
How often now does this group meet?
Once a month. It is once a month. We're usually at the Department of Health building in Conference Room B. And we meet